Welcome to the Crothall Healthcare High-Profile Cleaning and In-Service Education Series for the Pericept and Navigator Dilution System. This video will outline Crothall Healthcare's proven methods of cleaning and disinfecting, as well as the importance and advantages of Pericept and why it's rapidly becoming the #1 disinfectant to combat C. diff and other deadly healthcare-associated infections. In the United States, the Centers for Disease Control and Prevention estimated roughly 1.7 million healthcare-associated infections from all types of microorganisms, including bacteria, combined cause or contribute to 99,000 deaths each year, costing healthcare billions of dollars. Healthcare-associated infections highlighted the need for efficient infection control and environmental services programs and processes in all healthcare settings. These programs put together various practices, which, when used appropriately, restrict the spread of infection. With the increase in multi-drug resistant organisms, environmental cleaning and disinfection has become an even more important component of infection prevention strategy within healthcare facilities. Infection prevention and operational efficiency can both be accomplished with a clear protocol, along with training, best practice implementation, and ongoing monitoring. Controlling healthcare-associated infections is recognized as a battle in itself. Until now, infection preventionists and environmental services have unfortunately had to combat sporicidal disinfecting agents that require additional labor due to their inability to clean, and cause damaging corrosion, leave unsightly residue, and costs healthcare systems a tremendous amount of money in equipment replacement expenses. In an effort to provide our associates with the most effective tools possible, Crothall Healthcare began a search for a high-level disinfectant with improved efficiency. This search led us to a new product called Pericept, a technologically advanced, EPA-registered sporicidal disinfectant cleaner.
Pericept Sporicidal Disinfectant Cleaner. Pericept Sporicidal Disinfectant Cleaner eliminates and prevents the spread of C. difficile, MRSA, Enterococcus faecalis, VRE, Staphylococcus aureus, Klebsiella pneumoniae, Acinetobacter baumannii, Pseudomonas aeruginosa, Enterobacter species, and many other pathogens commonly found in healthcare settings. Pericept contains no alcohol or bleach, requires no rinsing, and leaves no film on hard surfaces. As a hospital-grade disinfectant cleaner and sporicide, it is ideal for main hospital and MOB surgical rooms, patient rooms, operating suites, physical therapy departments, nursing services, autopsy facilities, long-term care facilities, nursing homes, doctor offices or clinics, and so much more. One of the biggest challenges facing sporicidal disinfectants has been the odor or the strong vinegar-like smell. A major advantage of Pericept is because of the high dilution rate of 1:32, which greatly reduces the strong odor-like smell. Although it still has a small odor, it is much less than other sporicidal disinfectants. Pericept, as we like to refer to it, truly is today's smell of clean. Pericept preparation and use. Pericept, a technologically advanced EPA-registered sporicidal disinfectant effective against C. diff in only 2 minutes. Pericept is a one-step, one-application sporicidal disinfectant cleaner. Pericept is made by blending concentrated hydrogen peroxide with peroxyacetic acid in solution. Safety first. Step 1. Put on gloves and eyewear. While handling Pericept in the concentrated 2-liter container, personal protection equipment applies. The PPEs include wearing chemical splash goggles where there is a potential for eye contact, rubber or neoprene gloves, appropriate footwear, and aprons or full protective clothing. Step 2. Installing the bottle. Carefully remove 2-liter concentrate from carton. Remove black screw top from the 2-liter concentrate and connect the 2-liter by screwing black cap from dispenser onto bottle and slide into bracket. This will help ensure you have a tight seal and will prevent any leaking or overspray. Once connected to the chemical dilution system, Pericept is diluted to a 1:32 dilution ratio. While filling the charging bucket with the Pericept diluted solution, although this is only done for restrooms, it is important to follow the recommended use solution for preparing microfiber for cleaning and disinfecting. This information can be found on the wall chart located by each dilution control station in the facility. Step 3. Dispense the solution by pushing and holding the lever up. Then you may dispense it into a secondary bottle or chemical dilution bucket. Important: when filling secondary containers from the Navigator dilution control system, you must remember to control the flow of the Pericept with the on-off button. Failing to do so will cause runoff of the product as well as unwanted odor. Step 4. Fill chart. Always refer to the fill chart to ensure that you use the proper amount of cloths or mops with whatever amounts of chemicals you are using. You never want to use too many cloths or mops, as this may not completely saturate them, which would not make the cloths or mops 100% effective. Step 5. Pour the contents into your secondary bottle or chemical dilution bucket with the recommended 2 ounces per microfiber cloth. Remember to take your time when doing this. You always want to be careful not to spill the contents if possible. Step 6. Set. Pour the contents into your secondary bottle. Always use a properly labeled secondary bottle when adding Pericept wiper canister. Wait 15 minutes for the contents to fully saturate the microfiber in order to get the maximum effectiveness of the cleaning. Before exiting your EVS supply closet, you should carefully remove your PPEs and wash your hands according to standards. Whenever you are not completely sure about a procedure, always remember to refer to the SDS safety data sheet before handling any chemical. How does Pericept work? Peracetic acid disrupts the outer membrane, endospore, or coat of the target spore, bacteria, or virus. Hydrogen peroxide oxidizes and destroys the internal components. Unique surfactant package increases efficacy, killing power, by getting the actives to the spore surface. Product storage and handling. Pericept should be stored in a cool, dry, well-ventilated area. For quality purposes, avoid temperatures above 86 degrees Fahrenheit. Do not double stack. Use first in, first out storage system. Containers must be vented. Higher temperatures will accelerate decomposition, resulting in loss of actives assay and cause excess gassing of material, possibly resulting in bursting of container. Do not store Pericept containers near reducing agents, fuels, direct sunlight, near sources of ignition or heat. Do not try to open sealed containers of Pericept. Product is extremely corrosive to eyes and skin. Spilled materials can ignite organic material such as paper, fabric, cotton, leather, or wood. Do not store Pericept containers on top or above other materials such as cardboard cartons of cleaning products or paper products. Best place is to store on concrete floor or other hard surfaces. Be careful and avoid getting it into your eyes, as it may cause burns and in some cases could result in permanent injury, including blindness. Getting it on your hands or skin can cause corrosive burns. Brief exposures may cause irritation. Inhalation, mists, and vapors can irritate the nose, throat, and lungs, but will usually subside when exposure ceases. Ingestion can cause gastrointestinal irritation, nausea, vomiting, and diarrhea. In all cases, consult the Pericept label and safety data sheet for additional safety and handling information. In case of an emergency, call 1-888-779-1339. In case of a spill, immediately shut off any sources of ignition. Evacuate any personnel not trained in handling spilled material. Ventilate area well. Do not allow contact with organic materials such as paper, fabric, cotton, leather, or wood. Do not walk in product or allow contact with footwear or clothing. Wear protective clothing, chemical splash goggles, rubber or other chemical-resistant gloves, and rubber boots. Use positive pressure self-contained breathing apparatus for confined or poorly ventilated areas. Do not allow undiluted material to enter floor drains or sanitary sewer systems. Methods for cleaning up combustible materials exposed to hydrogen peroxide, an ingredient in this product, should be immediately submerged in or rinsed with large amounts of water to ensure that all hydrogen peroxide is removed. Residual hydrogen peroxide that is allowed to dry, upon evaporation, hydrogen peroxide can concentrate on organic materials such as paper, fabrics, cotton, leather, wood, or other combustibles can cause the material to ignite and result in a fire. Do not discard rags, mops, or other cleanup materials into trash without first being thoroughly rinsed with water. In the neutralization of a spill, you must first add sodium carbonate, soda ash, at a rate of 1 to 3 pounds for each gallon of concentrated solution. Excessive carbon dioxide bubbles will be present, which will dissipate quickly. Continue adding sodium carbonate, soda ash, until final pH is 6 to 7. Dispose of the product in accordance with state and local regulations. You are now ready to disinfect with Pericept using Crothall's high-profile cleaning standards. Some of the most commonly used areas are bed rails, walls, bedside tables, call devices, high-touch surfaces, headboards, counters, restrooms, toilets, showers, floors, X-ray equipment, operating room tables, and other hard surfaces. It is also good to remember that as this training program is very specific, you should always take notice to your surroundings and other high-touch surfaces. It is literally impossible to list every high-touch surface that needs disinfecting. Quite often, most of these areas are places we don't even think about and which are touched by many people hundreds of times a day. So when you are cleaning and disinfecting, follow your company's proper cleaning protocols as required, as well as using common sense. When it comes to germs and diseases, they play no favoritism as to where they may linger. High-profile cleaning. Crothall Healthcare's high-profile cleaning process has been developed to standardize the occupied inpatient cleaning services that we provide to all patients every day. Through the implementation and practice of this process, we can ensure a safe and clean facility for the patients we serve, enhancing their hospital experience while reducing their exposure to hospital-acquired infections. This process helps reduce hospital-acquired infections by sanitizing high-touch surfaces critical in preventing the spread of infection. It also improves the patient's perception of cleanliness by focusing on the engagement between the housekeeping staff and the patient. By using Crothall's high-profile cleaning process, Housekeepers will ensure all high-touch surfaces are disinfected daily while engaging in eye contact and meaningful conversation with each patient. Although the steps involved in the high-profile cleaning process are presented in a definite order, it may become necessary for your facility or specific unit to modify or change the sequence of steps. However, the order in which this process is presented will prove to offer a comprehensive, systematic approach to providing excellent, consistent cleaning throughout the facility. Step 1. Interact with the patient or guest. Crothall Conversation Guideline should read as, "Good morning, Mr. and Mrs. Patient. I am your housekeeper today. I am here to clean and sanitize, disinfect your room and bathroom." Say, "I am here to clean and sanitize your room." Follow proper hand hygiene protocols. Step 2. Empty waste receptacles. Using EVS, ask if there is any other trash items within the room that need to be disposed of before removing the bag by saying, "Is there anything else you would like me to throw away before I pull your trash?" Ensure knots and extra bags are facing the wall and not visible. Keep biohazard waste separate from regular waste. Do not compress waste with your hands or feet. Hold waste away from your body. Don't forget to clean the waste receptacle inside, outside, and on the bottom using Pericept. Remove soiled linens and check the needle sharps box. Step 3. High dust above the eye level. Using EVS, explain that you will begin high dusting at this time by saying, "I will be dusting up high now." Never high dust directly over a patient guest or their food. Do not high dust in an occupied ICU, CCU patient room. Don't forget to check the walls around vents for blown dust. Thoroughly high dust after patient has been discharged. Work from right to left or in a clockwise direction around the room. Step 4. Disinfect all horizontal surfaces. Using EVS, explain that you will now clean and disinfect the room by saying, "I will be cleaning, disinfecting your bed rails, bedside table, over the bed table, call button, remote control, and telephone now in order to keep you safe and free from infection." First, use Pericept to address the high-touch surfaces nearest the patient, including bed rails, over bed tray table, bedside table, nurse call button, and telephone. Use Pericept properly. Let surfaces air dry following required dwell times. Pericept kills harmful microorganisms. Ask the patient if there are any other areas they wish to have disinfected. Step 5. Disinfect vertical surfaces. Using EVS, explain that you will now spot clean walls and curtains by saying, "I'll now be cleaning the walls and curtains around you." Use Pericept Cleaner. Pre-test an inconspicuous place on the wall before using Pericept. Work from left to right in a clockwise rotation around the room, making sure you check each wall and curtain for stains. Clean the windows to remove any prints or smudges. Use Pericept to clean any visible soilage. If a stain cannot be removed from a curtain, call your lead or manager for a curtain change. Don't forget to clean around waste receptacles and light switches. Pericept needs time to work effectively. Step 6. Clean and disinfect the restroom. Using EVS, explain that you will now disinfect the restroom by saying, "I'm going to step away for a moment so I can clean and disinfect your bathroom." Disinfect the sink, shower, and toilet with Pericept. Do not use toilet bowl brush outside of the toilet bowl. Fill all paper, soap, and shampoo dispensers. Empty trash and remove used linens. Clean the mirror with Pericept. Leave a great impression by V-tipping toilet paper and leaving blue disinfectant in the water. Step 7. Dust mop the floor. Using EVS, explain that you will now sweep the room to remove all debris and dust from the floor by saying, "I'll now be mopping your floor." Start at the farthest side of the room and dust mop toward the door. Always dust mop before damp mopping, except in the case of a blood spill. Where applicable, follow microfiber process. Keep the leading edge of the mop moving forward. Do not shake mop to free excess soil. Be aware of traffic around you when dust mopping. Dust mop the entire floor, including under the bed and furniture. Remove the debris with your broom and dustpan, or approved collection method, inside the room's doorway. Step 8. Inspect your work. Using EVS, explain that you are now checking your work to make sure you didn't forget anything by saying, "It's important to me that you're satisfied with the cleanliness of your room and bathroom. Is there anything I've missed?" Check sharps containers. Make sure curtains are clean and in good repair. Check dispensers. Check windows for handprints or smudges. Is the room clean enough for someone you love? Ask the patient if there is anything you missed while cleaning. Step 9. Damp mop the floor. Using EVS, explain that you will now mop the floor by saying, "I'll be mopping your floor with Pericept. It will be wet for a few minutes, so I'd ask you to please don't walk on it. Is there anything else I can do for you while I'm here?" Ask the patient or guest to refrain from walking on the floor until it is dry. Ask the patient if there is anything else you can do for them before mopping your way out of the room. Make sure you placed a wet floor sign before mopping. Start at the farthest side of the room and mop toward the door. Mop the entire floor, including under the bed, under furniture, and the restroom area floor. Change the approved mop solution in your mop bucket every 3 rooms or more frequently if it's dirty. If using microfiber, follow appropriate process. Do not leave puddles on the floor. Don't forget the restroom floor. Step 10. Interact with the patient. Using EVS, let the patient or guest know that you completed cleaning their room by saying, "I finished cleaning and disinfecting your room, Mr. or Mrs. Patient. Is there anything else I can do for you before I leave?" Tell the patient and guest goodbye. Follow HIPAA regulations and proper hand hygiene protocols when exiting the patient room. Thank the patient for choosing the hospital and let them know if they need any housekeeping, they can call housekeeping at any time. Standards of behavior. Integrity. A commitment to forthright, honest communication in all encounters. I am committed to finding solutions. I do not complain or blame others. Collaboration. An unyielding commitment to consistent teamwork in order to achieve collective goals. My team member and coworkers can count on me. I congratulate coworkers on a job well done. I am open to change. I share my ideas with my manager and team. Accountability. As a company and as individuals, we accept full responsibility of our actions and the associated outcomes. I do what I say I will do. I report to work on time and in proper form. I treat patients as if they were my own family and friends. Professional development. Providing the right tools, training, and support for professional growth. I accept constructive feedback. I accept responsibility for my own development. I take advantage of Crothall's training opportunities. Leadership. Displaying the passion to exceed expectations in all we do. I always do the right thing. I always follow the company's values. I am passionate and enthusiastic about my work. I will devote 100% of my attention and efforts in doing my job to the fullest. Introducing EVS. Crothall Healthcare has been a patient-focused company since our inception. Throughout our history, we have focused on communicating with our patients in order to lessen their anxiety and identify their individual preferences. We've used scripting, keywords, and most recently, Crothall Conversations as guidelines for associate-to-patient interaction. In conjunction with our rollout of high-profile cleaning, we're introducing the EVS concept created by our operators. Each patient and guest interaction will include the EVS concept. Eye contact, voice projection, smile,
The goal at Crothall Healthcare is to define a systems approach to implementing a healthier, patient-centric environment. Environmentally sound cleaning and disinfecting practices supported by training and monitoring strategies that positions Crothall in the healthcare sector. Our actions are a reflection of the Crothall commitment. We at Crothall Healthcare, along with our strategic partners, have implemented an outcome-based program. The combination of tested processes and products has resulted in proven solutions to combating healthcare-associated infections, in particular, Clostridium difficile.